Hello everyone, my name is Eric, I'm 30 years old and I live with my wife and two pets, a cat and a dog. I was diagnosed with a NET in 2017. My initial tumor was found near my terminal ileum. I found out about my NET because I started experiencing a partial blockage caused by the tumor. I got my diagnosis in May, but I had digestive issues since October of the previous year. Leading up to my diagnosis, my primary care provider did a great job hearing me out and scheduling the right tests. One day, halfway through my scheduled tests, I got a call from my PCP. Having just had a CT scan, he was calling to explain that the radiologist had found a tumor. It was a little strange to get a diagnosis over the phone, but I really appreciated his urgency. He said the tumor was only an inch or two in diameter, but it looked like it might have metastasized. The next step for something like this was going into surgery as soon as possible. At the very least, they could fix the blockage, and during surgery, they'd be able to biopsy different tissue around the tumor to see how things had progressed. This made a lot of sense to me. I was ready to go into surgery, get it done and over with, right? Move on with my life. Just to give you some backstory, my family, as young as it was at the time, had been through some major medical scares already. You see, at the age of 23, my wife, then fiance, suffered from scar tissue complications caused by a childhood surgery. One night, she woke up in terrible pain and was rushed to the ER in the middle of the night. Within a few hours, I was watching her get rolled into emergency surgery. I still remember it as one of the scariest moments of my life. So for all of you caregivers out there, the feeling of sitting in a waiting room is indescribable. Your loved one is just a number on a screen, and all you know is whether they're in pre-op or in surgery. Maybe at some point the surgeon walks up to you, still dressed in scrubs, to explain what's going on in the EOR. Maybe they ask you to make a life-altering decision about that life that's laying there so vulnerable. It's an experience that I wish on no one, and my thoughts are with each of you that have had to sit in that nerve-wracking waiting room. Surgery can be very scary. In our case, with help from both of our families, we made it through that first experience stronger than before. My wife ended up needing a second surgery just after we got married. Recovery was hard, but because she had done this before, we knew what to do. We had been through it, and everything was going to be okay. Fast forward 6 months, and all of a sudden our roles were getting switched. I was going into surgery and she would now become the caregiver. But my surgery went smoothly. I was in the hospital for about 5 days. And once I got home, things healed up pretty quickly. I was back to work within 3 weeks and returned to a normal exercise routine within a month. Everything was going according to plan. I had my first post-op appointment with a medical oncologist, and I was going to get the results from the biopsies, discuss plans going forward. That meeting did not go well, though. Everyone up to this point had been telling me that things were going great, but this doctor did a poor job of explaining the situation before telling me that I needed to go back into surgery as soon as I was able. In my previous surgery, they had gotten a better look at my metastasized liver, and they needed to debulk. This hit me pretty hard because I had really thought this would be a one and done sort of thing. The bad news and the poor experience with the medical oncologist made me want to get a second opinion, so my PCP got me an appointment with City of Hope for the very next week. So I met with Dr. Singh and Dr. Lee to discuss my situation. Although their recommendation was similar to my previous oncologist, they did a much better job explaining things. They took the time to listen to my concerns, showed me my test results, scans in detail, and helped me map out a plan that put my needs at the core. This experience taught me how important it is to have a good working relationship with your doctors. Understanding that these doctors were my proponents made a huge difference in how I felt about my treatment plan moving forward. Not everyone has the chance to change doctors, but if you have ever experienced a dismissive attitude from your doctor, find ways to better communicate with them. Try not to be afraid of asking questions or looking ignorant in front of your doctor. 10 extra minutes in an appointment can give a huge amount of relief. I ended up getting that second surgery to debulk my liver a few months later, and since then I've been on a monthly somatostatin analog. Over time, my nurse and I have learned what works for me to reduce residual pain at the injection spot. This was only because I started having an open dialogue about my experience with my nurse and doctor. It's been 3 years since my first surgery, and aside from having a few bumps along the way, I have a great team supporting me and keeping an eye on my situation. I'm confident that the treatment plan is right for me, which has given me the opportunity to experience my life and future in ways that I wouldn't have imagined.